Rediscovering the Kitchen, and other tips for heart health. First, the bad news: after decades of major progress in reducing deaths from diseases of the heart and blood vessels, the decline in cardiovascular mortality has slowed significantly, according to the latest report from the Centers for Disease Control and Prevention. The researchers called their findings alarming, suggesting that cardiovascular benefits from medical interventions may have reached a saturation point and that further improvements depend largely on changes in society and personal behavior. The new data, published in June in JAMA Cardiology, covered the years from 2000 through 2014. From 2000 through 2010, the annual rates of decline for all cardiovascular deaths, heart diseases. These findings point to near stagnation in controlling cardiovascular diseases and deaths, Dr. Stephen Sidney and colleagues wrote. And, they noted, the reasons are not difficult to discern. Based on data from the latest National Health and Nutrition Examination Survey in 2011-12, Americans did better in controlling three major risk factors: smoking, high blood pressure and elevated cholesterol, often with the help of medication, but many more people became obese and developed type 2 diabetes. According to data from the survey, the prevalence of adult obesity rose from 22.9% in 1988 to 1994 to 34.9% in 2011-12, and the CDC found that the prevalence of diabetes nearly tripled, from 2.5% in 1990 to 7.2% in 2013. Furthermore, the national survey showed, the percentage of adults who in 2012 were consuming an ideal diet that could minimize life-threatening damage to blood vessels was near zero. It's not that these grim data were unexpected. 4 years ago, Dr. Richard J. Jackson, a professor and former chairman of environmental health sciences at the University of California, Los Angeles, predicted that the current generation of young Americans, those born since 1980, may be the first to live shorter lives than their parents. Even earlier, in 2007, Dr. Earl S. Ford of the CDC and Dr. Simon Capewell of the University of Liverpool wrote that unless measures were taken to transform the abhorrent risk factor profile that currently characterizes much of the U.S. population and dangerous trends were reversed, mortality rates among younger adults may represent the leading edge of a brewing storm. Now for the good news: neither medical innovations nor genetic interventions are needed to turn the tide on cardiovascular diseases and deaths and restore their once significant declines. And the very same changes needed to improve cardiovascular health may also help prevent many common cancers: diabetes, arthritis, cognitive decline, depression and osteoporosis. Dr. Donald M. Lloyd-Jones, a chief architect of a 2010 strategic plan to improve cardiovascular health, said, "The whole may be greater than the sum of the parts. We shouldn't assume that chronic diseases automatically occur with aging. Living healthfully until we die is an achievable goal." Dr. Lloyd-Jones, a cardiologist and preventive medicine specialist at the Northwestern University Feinberg School of Medicine in Chicago, chaired an American Heart Association committee of experts that adopted the recommended changes. Instead of focusing on the negative, the plan aims to achieve ideal cardiovascular health through ideal health behaviors and ideal health factors. Here's how the committee defined ideal: no smoking, maintaining a body mass index below 25, being physically active, following current dietary guidelines, and maintaining an untreated total cholesterol level of less than 200 mg, an untreated blood pressure level of less than 120/80, and a fasting blood glucose level of less than 100 mg.